Well, thank you so much, Hint Health, for asking me to participate in talking a little bit about your product. You know, Hint has been a part of my members MD since almost the beginning, and we have also had them as a part of our Strata Healthcare. So Strata Healthcare is my direct primary care practice. And in the past year, we've added affiliates in Iowa, Washington, D.C., Florida, Wisconsin, Arizona. And so to be able to do that and, you know, stifle out the money to the different practices and the different docs is not something we can do. I think you got to hear my wife talk about, we thought we could do all this just with a little bit of a operating system ourselves. And that actually, when she's speaking to that, was not even the Strata Healthcare part. She was just talking about trying to manage our members MD patients. So Hint in the background just does all of that for us. It takes care of, you know, we just assign the patients inside. So Hint knows where they go, and pretty soon the money flows to them. They know the number of docs. The different docs can log in themselves and make sure that it's accurate and that they're being appropriately reimbursed and those kinds of things from the primary company. And Hint has made that all so easy for us to work with. And I must admit, the move up to HintOS has even been greater. So if you've looked at Hint in the past and you haven't looked at them recently, it's something you need to do. And from that standpoint, it's exactly why I wanted to invite Cari to the stage. And Cari, if you want to turn your camera on. So literally, I'm just sitting at dinner Tuesday night, and Cari and I are having a conversation about, you know, what we're going to be doing while we're here at the conference. And I said, well, I'm going to do a little ad gim for Hint. And she's like, oh man, that's been the greatest thing ever for my practice. So Cari is a recent convert to Hint. I've used them for a long time and understand their process implicitly. And I'm going to give Cari the mic, and I want her to talk about what it's done for her practice.
Yeah, so I've been in practice for 4 years. And so last year, my practice finally made their conversion over to Hint. Mostly, just like your wife was saying in the video, if spreadsheets were just getting too long and too cumbersome. And it was taking at least an employee at least 3/4 time to keep up on the billing, the spreadsheets, invoicing, making sure people had paid, having all the data in one place that we could see it was really getting hard. And so we made the decision last October. It's been exactly a year to go with Hint. I was worried about the conversion. I just thought we were so busy and I didn't have the time to even figure out how to get the data to them. But literally, we sent our spreadsheet over that had most of our patients, we hoped. It was even hard to keep track of that at the time. And their date that they signed up and our pricing. And it seamlessly, within, I think, 7 days, we were up and running. It's made it so easy to do my billing and my invoicing. I literally have 3/4 of an employee back and my staff, probably for what I pay Hint and what I pay an employee, probably saving $30,000 a year by making my conversion to Hint.